I'll introduce you first, and then you would know that. Yeah.
Sure.
So hi everyone, I am super happy to have with me a very dear, a very bright student with me, Dr. HAMSAVARDHINI. She is an awesome performer with a rank 7 in NEETPG 2024. Such a wonderful, wonderful performance, and so proud of you, beta.
Thank you, ma'am.
And the result was announced really suddenly. So, can you tell me about your experience? And then when you saw rank 7, did you quite believe yourself?
No, ma'am. I usually ask my father to check my results, be it anything from school days. So I just sent him my hall ticket, my roll number, and I sent him the PDF document that was forwarded in all groups. So he checked it and he said 7. I asked him to check it 4-5 times, and I checked it multiple times to believe it was true. Still not fully sunk in, ma'am, but yeah. I
This
think
is
it's
so
all
great.
God's grace.
So he has always been your lucky charm, right?
Yeah, both my parents, yes, ma'am. My dad has definitely been very instrumental through most of my
So
education.
a big congratulations to them. I'm sure they've contributed a lot into this.
Definitely, ma'am. If not for them, then I stand nowhere.
Absolutely. And that's someone who's so grateful like you will always get lots and lots of more in life, abundance. So
Thank you,
great.
ma'am.
So let's talk about your journey, HAMSAVARDHINI, because this was I think was the biggest exam of your life, probably the one that you've given so far.
Yes,
And
ma'am.
it went just on and on and on. It was like not happening. So it's a
Yes,
long
ma'am.
journey, and we would want to know something about your journey, how you started, and how far you have come.
Ma'am, I studied in CMC Vellore. I began my undergraduate studies in 2016, so I belong to the batch of 2016. And fortunately, by God's grace, I've been consistently the topper all through my UG days. And we also have a 2-year bond, ma'am. So we are allowed to apply for counseling to other colleges only after our second year of bond, and I'm still in the final phase of my second year bond. So last year, though I did write the exam, I wrote it with the intention of not applying for the counseling at all.
Yeah.
So this was the serious attempt that I had in hand, and I think God has been very, very gracious.
And I think you've also put in a lot of hard work, a lot of efforts, right? So
Thank you.
very well deserving. So HAMSAVARDHINI has been, a student with us. She's enrolled into Deadly Combo, which includes a lot of little, and so many things there. So let's hear from you. Let's hear from you. What all resources you thought you've used and could help you from DAMS to reach here to be a little part of your journey, I would say. And also I would want to have a good insight about the paper, and then we will discuss about your strategy in detail.
Sure, ma'am. Ma'am, I came across DAMS at a very, I would say, crucial phase, but a little late in the phase of my preparation. But I think at the right time, I should probably agree. And the DAMS Deadly combo was actually a very, uh, I would say, very content-rich resource. So it had TVT, PYQ kebab, and both the question bank and previous year questions. Definitely, the DVT sessions are so, I should say, so content rich, and it had everything important that had to be covered. And I think it's the go-to resource for the last minute, last phase of preparation, ma'am. If we have been thorough with our concepts earlier on, I think that is definitely a great resource, ma'am. Thank you so much for that. And
Thank you.
apart from that, ma'am, the PYQ kebab sessions are also very good, very nice, and even some of the question bank with video solutions are also helpful. So whichever topics I felt I was weak in, I was able to utilize those sections in the question bank, and see those explanations in detail with videos. So it was very useful. And I think the grand tests were really, really nice, man. The mock tests, they were very similar, simulating the exam pattern very closely. So I think that's definitely a big confidence booster just in the last few weeks before the exam.
Right. And did you use, I think you gave the CBT as well, right? So how was
Yes,
your
ma'am.
experience with the CBT?
The CBT was a very real life simulation of the exam, ma'am. In fact, I told my mother that after writing the CBT, I felt like I had finished writing NEET. And I had, though I had, I think, a 10 days gap before the
Yeah.
actual exam. It was on the 1st of August. It was a very good experience of going to the center, writing it. That is, though I've taken numerous GTs at home or in hostel, I think nothing comes close to the CBT, ma'am. That is something that is unique, and I think everyone should go through that.
Okay. And also, Bache, when the NEET PG was postponed and we were just thinking about how to put everyone back on track, and we did the mini TNDs, right, on the app, which were also part of the
Yes,
Deadly Combo. So do you
yes,
think
ma'am.
that those had a good hit rate, or, I would say the topics that were asked in the exam and
Yes,
covered in the
ma'am.
mini TNDs?
The topics definitely had a good coverage, ma'am. I must admit I didn't listen to each of those videos, but I solved those questions. And in case I made a lot of mistakes, only then did I go back to the TND session and I saw those
Right.
solutions. So I didn't really spend time on the TND session per se, but on the questions I did, ma'am.
So great. I think you utilized all the test paper that were there in the Deadly Combo, and I
Yes,
think that has
yes.
that has actually helped, because you
The
really get to
questions
know where
are
you need to improvise.
absolutely, ma'am. The questions are very, very similar to the real life questions. Yeah, so it was very useful.
Okay, great. So now, Bacha, can you tell me overall, when you have gone through this paper, this was quite different from the NEET PG paper, which was held last year or before that, right? And I think you would be the right person to give us a good introspection onto what do you think was different in this paper, right? For example, do you think the content was more detailed, more in depth? Do you think that it was more clinical but yet converted into one liners? I mean, what is your take on the paper?
Ma'am, it was very integrated. A lot of questions were involved in multiple subjects, and
Right.
some questions were just boiled down to previous one-liners. There were questions like that, previous year questions, which just boiled down to a one-liner. There were a lot of these questions, especially surgical questions, ma'am. I think ENT, OBG, general surgery, all of them had a lot of these image-based questions, and some of them were very vague, ma'am. Especially ENT, I think there's questions that were not covered in even in our standard textbooks or by any. I think it was probably set. But I was thinking at the end of the exam, I was thinking probably some surgeon, hardcore surgeon, has set this paper. Uh,
Right. Quite a
a lot of
possibility. Yes, yes,
Yes,
yes.
ma'am. A lot of even laparoscopy images, especially in OG,
Yes.
they only my only worry was that those images are not really labeled. As in, so getting an orientation was a little hard, but I think most of them could be deduced by logic and by applying concepts that we learned earlier, ma'am. So it was not.
Exactly. I think this is the point that is most important, what you just mentioned, that the paper was doable if the concepts are good. Because I think in a lot of questions it was about ruling out options from the
Yes,
content that you already have, instead of saying, oh, this is exactly something that I have seen. More than
yes,
that,
ma'am.
it was about, this is something I
Apply.
know, and through my knowledge, yes, the application. Absolutely. I think you're very right on that. Also, can you tell me when you attempted the question? I agree, some subjects maybe really, like you mentioned about ENT, was out of the blue. But other than that, what would you suggest when someone is preparing for next year NEET PG? Should they focus on narrowing down their content, or a good width and especially depth in certain topics is essential?
Definitely, ma'am, going by this paper, I think it was very similar to standard of an INI paper, if not more, ma'am. I think certainly it requires a very good in-depth knowledge, especially some questions in medicine which had brainstem stroke syndromes, which are usually not asked in an INI. I mean, I can't speak. I don't know about the morning session, ma'am. This was from the evening
Oh,
shift
so
question.
you had an evening session, right?
Yes, ma'am. I had the evening session. So there were a lot of questions that require in-depth understanding, and just a superficial study would not help, ma'am. Is what
I
I feel.
agree.
Yeah.
And also, since we are talking about the paper and dissecting what it was about and how you should go forward, can you tell me what was your attempt ratio? How many questions did you attempt?
I attempted all 200, ma'am.
Or 200. So yes, so I would say even in the evening session it was doable, but as you rightly said, you had to apply your knowledge rather than saying this is
Yes,
directly
ma'am.
from, the thing. All right,
Yes.
perfect. And would you also want to comment something on distribution of subjects? For example, let's say a junior of yours asks you that, ma'am, what subjects do I give more importance to, and what subjects, are less important? Is there anything like that that you can now say of?
Ma'am, I think definitely all the clinical subjects are very important. Looks like a very clinical paper. Third year, fourth year subjects definitely had a higher weightage, I think, than the first year, second year. Because even the pathology, microbiology ended up being a clinical case. So I think the third year, fourth year, unlike in INI, which focus more on the first and second year, I think the third and fourth year subjects had a higher weightage. Is what I feel. Ma'am.
I agree. So I think some keywords that I can grasp from what her experience has been is clinical integration has been top notch in this paper. Depth of content has been top notch. Application of concepts has been top notch. And now coming to MCQ skill, because yes, content is always going to be important and content is the king. But yes, you need to sort of know some aspects of your MCQ skill. So, if somebody asks you that they are stuck at a GT score of, let's say, 140 or 150, what would your advice be? How to improve the number of correct questions? And what do you think your number of correct questions has been in this paper or in the last GT that you gave? Let's say CBT.
I must admit, ma'am, even I was in that phase of stagnation for a very long time. So till until I think the last 2 months in the exam preparatory phase, I was stuck at a GT score of 155 to 160, and I
Okay.
was simply not improving despite the number of revisions I did. But I think the idea of keeping a notebook for all the wrong questions and going through them, I think really helped, ma'am. So,
Yes, the wrong
and
diary
also
is important.
wrong
Absolutely.
worry, yes, ma'am. It was definitely instrumental, and also I think I also kind of realized the more the number of revisions you go through, I think the score somehow dramatically improves. It's those small confusions between two options that you end up making a mistake in. I think that margin reduces as the revisions increases. So towards the end, my GT scores are around 170, close to 160, 170, ma'am. So yeah, even CBT was, I think I got around 174, ma'am.
Wonderful.
It was,
And what do you think is the number of correct in this paper in the
I,
evening session?
I really don't
No
know,
idea.
ma'am. I think 160 to 170. I'm not sure.
Fair enough, fair enough. It's just a rough estimate. So yes, you've done exceedingly well, I think, and it
Thank you,
shows
ma'am.
that it has been a consistent effort. It's not just a one night thing or not last 10 days thing. It is something that you have to be good at and you have to be constantly working on. Yes. And now I would say, if you have to give an advice, let's say I'm your junior and I'm asking you, ma'am, please tell me the 3 most important things that I should do to get a good rank as you did. What would those 3 things be?
Ensure your concepts right from undergrad days are strong. I mean, it is not important to just study for the exam for the sake of it. If you're looking long term, both in terms of good patient care and in terms of performing well, I think it's important to be consistent from undergrad days. And the second thing would be that to pay attention to concepts, I think, more than just mugging up facts. I think that is a trend that has changed for good over the past few years in NEET. And probably a third one would be to just surrender everything to God. Uh, I mean, just
Do your
putting your
best
best
and
effort
just hope for the
and
best.
yeah, yes, ma'am. I think it's God's grace ultimately.
Great, great. And you're such a nice person. It is a pleasure to talk to you, and I'm sure you'll always be a great doctor as well. What branch do you want to pursue?
Medicine or peds, ma'am. Mostly medicine.
Mostly medicine. I'm sure that you would do great wherever you are going to be. They're going to
Thank you. Thank
absolutely,
you.
love your presence there. Perfect, dear. It has been a great journey, and thank you for sparing your time and giving this insight. And I'm sure the students who listen to the interviews are going to at least figure out what they have not been doing, and maybe, yes, take the corrective measures at the right time.
Yes.
Yes. And anything
They,
motivating that you want to say, or also, apart from academics, is there anything else that you like to do, or,
yes,
to keep
I'm
the
a
stress away?
classical. Yes, I'm a classical dancer and a singer, so
Wow.
I just those are my stress busters all the
But
time.
great, great. So nice. You must keep that going as well, apart from your studies and academics,
Hopefully,
to
yes,
have a wholesome
hopefully.
life. And anything motivating that you want to say to your juniors or whoever is listening to you right now?
Um, just keep going. That is what I want to say, ma'am. Never give up and to just keep going. I think even I would say the same to myself. Even I mean, at any point in my life, I should just. This is a very long journey. I think we're all a part of a profession that is. Uh, that requires us to just keep doing what we have to do. So I think
So here's wishing you all the best, and
thank you,
thank
ma'am.
you for
Thank you,
making
ma'am.
dance a part of your journey. It's been a pleasure,
Thanks
and
for being with all of us, ma'am. And I should also say that probably dance faculty were one of the most easily approachable and I mean, I could interact with so many of the staff on the Telegram groups, approach them for doubts. It felt very reachable. So I must
so
thank, I must thank the entire team for that. Thank you, ma'am.
so wish you good luck. Keep smiling and keep doing great work, and all the
Thank you.
best for all your future endeavors.
Thank you, ma'am.
Take
See
care,
you.
sir.
Good night.
Good night.
Bye.
Bye.
Bye.